We've been picking up a huge amount of information, and it's been coming in thick and fast, and we have great data sharing from our colleagues such as Tulio in South Africa, but also around the world. And what we're seeing, especially in the European region, where countries have very sensitive surveillance systems that are able to pick up cases and start to really understand what the transmission dynamics are, we're really seeing now evidence that Omicron can circulate quite rapidly, including in a context of very high transmission of Delta virus.
So that's the transmission, Catherine, you're addressing there. But Tulio, can I ask you this question that's come to us from David? And we had a lot of questions like this one, and it's around how mild or not Omicron is. He says some scientists are suggesting, and this is from data particularly from South Africa, that Omicron is less deadly than Delta. If that's the case, isn't it good news if Omicron then becomes the dominant variant?
Okay, so that's a very important question. And the right answer is that, unfortunately, we have to wait another week or two to get idea on the severity of disease. Yeah, of course, that the early cases, they spread a lot in the younger population. And generally, the younger population will not develop very strong symptoms. Yeah, of course, that in South Africa, we have a good coverage of vaccine and a large number of previous infection. So we are hoping that that will help with the severity of the disease. But I would really like to caution the public about assuming that's a mild virus, especially in the beginning of a wave, because if it's sheer numbers of people get infected, and what we are seeing in South Africa is sheer numbers of healthcare workers already not presented to work because infection, that can put a lot of pressure in the healthcare system.
Catherine, this question is for you, and it's around boosters, I guess, and how much they protect you from getting very ill. Leslie says, I am triple jabbed. I still got COVID. How much worse would it have been without the triple vaccination? Because for me, it was pretty bad.
Yes, and I don't know how bad it was for her, but for people who are not vaccinated, bad can mean very, very quickly ending up in hospital and in intensive care and intubated for a very long period of time if you come out of intubation and if you survive that. Vaccinated, it means you may still get the virus. You might have something like a nasty few days or a few weeks, but you're much less likely ending up in hospital. And in the European region, we know that vaccination has directly saved the lives of close to 500,000 people. And that's really, really important. Now, vaccination is not targeted at stopping transmission, and it won't. But it is targeted at stopping people dying from COVID-19. And that's why it's so important that if people are not yet vaccinated with the first course of vaccine, let alone boosters, get your first and your second doses if you can. That's the most critical thing to do right now.
So that message is coming through very clearly, but we've had lots of questions around the boosters. So, Tulio, I'm going to ask you this one. Pfizer's saying at the moment that a fourth dose might soon be needed as well. And this question from Priya says, is this what's going to happen now? Are we going to just end up having to get boosters all of the time? Is that the future?
Okay, so thank you. Another very important question. And to the best of my knowledge, Pfizer released yesterday that a third dose may be able to suppress well the development of disease and severity. Yeah, of course that's great for the individual level, but we also have to be quite cautious with vaccine hoarding. Yeah, and our suggestion, and also from the World Health Organization, is that a third dose is given to people that really need it. This means with advanced disease or immune suppressed comorbidities, and that we also prioritize first and second dose on places that do not have vaccine access, such as many African countries.
Yeah, Catherine, we just heard from one of your colleagues, actually, Kate O'Brien, just in the last hour or so, talking about the concerns around vaccine hoarding and boosting. So that's very much one of the messages from today. Catherine, can I ask you this question from Beth, who has an 8-year-old. She wants to know how safe it is to vaccinate children under 12, which is not happening in lots of places, but there's a suggestion that it might. She said most children only have mild symptoms, so is it necessary?
There are lots of considerations that need to be taken into account when vaccinating very young children. So for WHO, that's the the children in the age of 5 to 11-year-olds. Several regulatory or regional regulatory authorities have issued some recommendations in that age group, such as the European Medicines Agency, and they've issued a single recommendation for one particular vaccine product, that's the Pfizer-BioNTech vaccine, and some countries have opted to recommend vaccination among that age group, and some countries are starting. So what are the issues here? Well, it's certainly safe to do so, and I certainly wouldn't caution any people from holding back on the question of safety. The questions that need to be really understood is that children are less susceptible to COVID-19 in general. And a lot of the arguments for including them in COVID-19 campaigns is really because of the kind of driving factor that those younger age groups are playing at the moment in regions like the European region in terms of seeding transmission in other age groups that may go on to have more severe disease. But as for any vaccine, there can be very, very, very rare complications. We know that the vaccines are safe, but there might be very, very rare risks to those children. So it is something to consider very carefully. But as Tullio said, at the moment, from a WHO perspective, our priority still needs to be to protect those from severe disease who are at high risk of severe disease. And that's people who are older, people with comorbidities, people who might have immunocompromised immune systems. And that's where we should be putting all of our efforts still, even within Europe, where there are large pockets of people that remain unvaccinated.